Hi there, welcome to this myofascial routine for the hips and for the lower back. For this practice, you'll just need a foam roller, a soft sort of Pilates style ball, not fully blown up, so with a little bit of squidge to it, and two myofascial balls as well. And we're going to be really working on all of the muscles around the pelvis and the hips, and as I say, also working into the lower back. So this is a great practice if you are doing a lot of sitting, if you experience some discomfort in your lower back. Of course, none of the practices that we do should be painful or feel like they're exacerbating pain, but it's not uncommon for many of these muscles around the pelvis and the hips to be quite tight, and it can sometimes be a little bit uncomfortable. But I always say, you should be able to breathe as you're doing these practices. If you find yourself tensing or guarding or sort of protecting yourself, then you're probably doing too much and you just need to reduce the pressure. Many of these practices can also be done at the wall as a way to reduce some of the intensity of the particular technique as well. And I'll indicate that as we go through. So we're going to start this practice on the back of the pelvis, and we're actually going to begin with the foam roller. So for this one, you're just going to come to sit on your foam roller, and you can use your hands behind you for a little bit of support here. And then you're going to just roll to one side, one glute, and I'm going to just start to use the feet here to slide the foam roller up and down. So really going for a more sort of general, broad approach here, just hydrating these muscles right on the back of the hip and the buttock area. And go on both sides. I'll be moving through all of these techniques fairly fluidly, but obviously if you find that there's one particular technique that's really working for you, spend longer, always pause the video. Okay, I'm going to go back to the first side and now put the ankle over the knee. So I'm coming into sort of this supine pigeon variation. Again, tipping over to that right glute. And again, now with the knee in this position, leg in this position, I'm sort of stretching the muscle a little bit more and again, rolling. And you can do also a little bit of side to side movement, finding a couple of good spots in there. And as always, using these techniques to just give you some more information about the tissues, how this area is feeling. And as I say, if you find that there's one particular spot to the other side that is really calling your attention, you can spend a little longer. Ensure, as always, that you can breathe. It's not so intense that you're holding your breath. Maybe a little side to side in this position as well. And you'll get a feel here, particularly with this work with the foam roller, that it's a little bit broader, less specific and targeted than working with the myofascial balls. Great. All right, then from here, you come off the foam roller and use the foam roller for one more technique on the back of the pelvis. So coming down onto your back, and you're going to lift your hips and now slide the foam roller underneath the back of the pelvis. I'm going to hold the edges of the foam roller here just so that it doesn't slip out, and then bring both knees in towards the chest. Now from here, I'm just going to tip a little bit towards the right. So I'm on the sort of the side of the sacrum here, and I'm just going to start to sort of march the legs, like a little mini micro march in place. This is a nice one to just hydrate the tissues that connect the spine to the pelvis, the sacroiliac joints. You have had experience of sacroiliac joint pain or dysfunction, this might be a particularly useful technique, particularly if there's a lot of stiffness or tightness in this area. And then moving to the other side, again, just leaning your weight a little bit to the left. And just pumping the legs forwards and back a few times. Great. And then from there, centering the legs, bringing the feet back down to the floor, and you can lift the hips just to move the foam roller out from underneath you. It's always worth just pausing for a few moments after the techniques just to begin to notice maybe any effect, any change. You might feel a sense of increased blood flow or warmth or circulation, maybe a sense of heaviness or settling in the hips. And then we're going to now move into a little bit more specific targeted work with the myofascial balls. And so you can take them out of their tote bag. And where we're going for, and I'll just show you specifically here, is the sacroiliac joints again in a slightly more targeted way. So the SI joints are these joints that, as I say, connect the sacrum, that triangular sort of shaped bone at the base of the spine, to the ilium, to the sort of pelvic bones. So I'm going to put the balls, I'm going to go for a couple of different spots. I'm going to start a little bit higher up, just on the side edge of the sacrum, and I'll work down then about midway, and then I'll also do one spot towards the bottom of the pelvis, towards the bottom of the sacrum, towards the tailbone. So lying on your back, and again, same idea, putting the balls underneath. I'm starting in that slightly higher point, and I am on soft tissue, so I'm not on the sacrum itself, but I'm just on the edge of the sacrum, and just taking a few moments to just lean your body weight in there. Now, with all of these different points, let sensation and intuition be your guide. So again, maybe for you, if this is a very tender area, maybe you're just taking a few deep breaths, letting the lower back relax, and letting the weight of the pelvis sink into the balls. But if it feels helpful, you could find a little bit of movement here. It might feel really good to do a sort of tucking and tilting movement of the pelvis. So arching the lower back and then flattening the lower back into the mat. And you'll feel the myofascial balls just moving a little bit up and down in the back of the pelvis there. You could also explore a really easy, mellow rock of your knees from side to side. See how that feels. And then we'll move the balls down about maybe 1 centimeter or 2. So I'm coming towards the middle of the sacrum. And the same thing here. Again, maybe just taking a few deep breaths, maybe being still if it's tender or sore. And maybe finding a little movement. Again, tucking and tilting. This is also just a nice way to improve mobility between the pelvis and the spine. It's called lumbar pelvic rhythm. And again, maybe finding a little sway of the knees from side to side. Just again, monitoring your breath. Noticing maybe if one side is a little more tender or stiff. And then I'll move the myofascial balls down about 1 more centimeter. So I'm kind of coming towards the bottom of the sacrum, kind of just above the tailbone, the coccyx. So I'm still on the balls, but it feels like I'm slightly almost about to tip off them. And again, finding a little tuck, tilt. Noticing for me, it's a little more tender down here, but you might be different. So again, just using all of the different techniques to explore and to develop a deeper sense of body awareness. Again, maybe being still, maybe finding a little sway of the knees. Okay, now from here, I'm going to just lift the hips, move the balls out, and I'll show you the next spot we're going to go for, which is right in the belly of the glute. So we're going right for the bullseye, the sort of the butt cheek, bullseye of the butt cheek. So a little wider and maybe a little lower than your first point. And so I'm popping the balls right into that bullseye there, taking the feet a little wider, and now keeping one knee still. I'll keep the left knee still here, and just exploring now, letting the right knee drop in towards the left foot, and then letting the right knee open out as far as it will comfortably go to the right. So I'm just windshield wipering just that right leg. And again, you may notice, particularly when you bring the right knee in, that you get a little more weight actually in the left ball. And then when you let your right knee go out to the right, you actually get a little bit more in the right ball. So the weight will shift. This is a nice active mobilization. And then I'll do the same thing for the left side. So now keeping my right leg still. And then just internally and externally rotating the left leg. Definitely a little more spicy, working into the lateral hip rotators. Some quite deep muscles that really control position of the thigh and the hip socket. Great. Okay, and then from here, again, I'm going to lift the myofascial balls, just take them out again, just take a moment. And now we're going to work a little bit more into this sort of side of the upper outer hip. So we're coming around to sort of glute medius. So I'm very much on the kind of the soft tissue of the upper outer hip. I'm going to take my right ankle over the left thigh, and I'm just tucking the ball in. I actually don't have a lot of weight on the ball initially, but then I'm going to just start to play with tipping my weight into that myofascial ball. And this can often be, for many people, pretty tender spot. So you can lean in and out of it. If you're feeling it's not too much, you can obviously put more weight onto the ball and rock a little here. Maybe slide the ball a little bit from side to side. Just moving the hip around. I'm just looking for any sore or tender spots. If it's fairly tender, an option is to actually contract the glute. So you can squeeze the glute, take a breath in. You'll feel less pressure on the ball with the glute contracted. And then as you breathe out, see if you can relax the buttock and let the ball sink in a little bit deeper. So that's a great technique to use, particularly if you're feeling a lot of resistance in the glutes. If it's feeling really tender, contracting on the breath in, and then seeing if you can relax on the breath out. A couple more breaths just to play through these tissues. This is an area very much concerned with stability of the hip. We use these muscles a lot when we're balancing on one leg or when we're walking, running. And it's a great release point, particularly for lower back, chronic lower back pain. So you may find this releasing your glutes does a lot to help relieve that kind of non-specific chronic lower back pain. Okay, I'm going to go the other side. So taking the left ankle over the right thigh. Again, to show you from this angle, I'm going to pop the ball right into the upper outer glute on that side. And then again, you might be still. You might rock in and out. And play a little bit through those tissues. The research suggests that about in between 30 seconds and 2 minutes is about right. There's about plenty really for the effects, the benefits that we're looking for here in terms of hydration and increased blood flow and circulation. Just moving the ball, and really any way, as long as it's sort of on the soft tissue of the outer glute, is fair game. So as I say, you can move the ball a little bit. Sometimes just moving it up or down a few centimeters makes, or even a few millimeters can make all the difference. If you find a particularly tender spot, you might just be still, take a few deep breaths, or again, if it's really difficult to let go, maybe contracting on the in-breath, squeezing the buttock. And as you breathe out, just seeing if you can relax and let go a little bit more. Just a couple more breaths. And this is definitely a technique you could do at the wall. So if it's very tender, I would recommend just taking your outer hip to the wall and putting the ball up against the wall. And you can just back off a little bit in terms of the intensity and the pressure, obviously, in that position. Okay, now coming off from that, we're going to use now two balls together, and we're going to continue to work on this side outer hip. So I've got the two balls sort of lined up here, and I'm going to come into this sort of more sideline position, and I'm going to put the balls again right into that upper outer hip. So if you feel there's a sort of a sticking out bone on the side of your hip bone, that's your greater trochanter, I'm just behind that. So I'm still very much on the soft tissue of the glute. And I'm going to use my legs here to help me just start to plow these tissues from the side of the hip towards the sacrum. This one, again, is can be quite a tender one. So again, feel free to take this up to the wall to do. And again, you could be still, you could do a little bit of that contract and relax technique. Or if you're feeling like a glutton for punishment here, you could play with moving the leg, that bottom leg, lifting and lowering, or even bending the knee and straightening the knee. With the two balls together, this makes it a little bit less intense. It sort of distributes the load a little bit more. So if you needed more, you could, of course, just do the one ball. I think most people find two is more than enough, though. Great. And then we'll do the same thing on the second side. So again, two balls stacked, one on top of the other. I'm going to lift the hips and rest the balls literally just behind that sticking out hip bone. And then using my legs to sort of plow. So if you're a little unsure, to show you on this view, I'm sort of doing this sort of action. I'm rolling the balls kind of towards the back of the buttock. And again, depending on what you need here, be still, or maybe explore lifting and lowering a leg, bending and straightening the knee. Okay, and then come off from this position. So that's the glutes taken care of. And we're going to move into some muscles in the front of the hip. And the first one I'm going to go for is what's called the tensor fascia lata, which is a muscle that comes down the sort of the side of the upper thigh. So I've been working more on the back, and now I'm coming just in front again at that sticking out greater trochanter bone, and I'm coming just inside of that. And for most people, if you think of like where your pocket seam is, it's sort of roughly around that area. It's quite a thin muscle that eventually becomes the IT band. So you can use two balls sort of stacked like this, or a little more intense is just going to be the one ball. I've done this technique quite a few times. I know in my body I can tolerate the one ball, so I'm going to just go with that. So to come into it, it's easiest to come sort of sideline and half prone. So I'm just resting the ball, as I say, in the front of the upper thigh, and I'm just using, wiggle a little bit to find a sore spot. And this is one of those muscles that can be a little tricky to find initially because it is quite a thin muscle. It doesn't have a whole lot of surface area, but you'll know when you're on it. It can have quite an intense feeling to it. And if you've got some tightness here, you might feel it sort of radiate down towards the side of the knee, and has a big implication for knee tracking and IT band health. And then just because it's a small area, I'm just moving little micro movements, just exploring this area a little higher. For me, I'm finding I found the spot there. And just taking a few breaths. And if this is feeling like a very potent place for you to work on, continue as you like. Otherwise, you'll switch to the second side. So again, I'm just going into that up outer thigh. So you'll see that I'm bringing my other leg out to the side just as a little counterweight. And again, I'm not quite facing the ground and I'm not quite side lying. I'm sort of halfway between those 2 points. And again, resting the ball on that upper outer thigh. Okay, that means you'll know when you found it. So many of these areas, it's pretty vivid once you find the right spot. And you can feel a little bit of a referral down the leg into the outer knee and actually even into the shin. So it's quite interesting sometimes to see how these different muscles have different referral patterns. Just a couple more breaths. Great. And then we're going to transition into the hip flexors. And the hip flexors, we're really going to be looking specifically at iliopsoas, which is a big muscle that actually inserts or attaches to the vertebrae of the lower back and then runs through your abdomen, and then it comes in through the inner edge of the hips and then inserts right into the inner groin. It's a very deep muscle and it's quite tricky to get into it. If you ever have had it released with a massage therapist, they'll go in through the abdomen because it's not really possible to get into it through the back. We're going to do a couple of different techniques. This muscle is one that I think we need to be sensitive with. It's very much plays a role in stability and mobility of the pelvis and the spine. And it's thought that it is also quite intrinsically linked to our fight-flight reflex or our stress reflex. And this muscle can get quite irritable, again, if we've been sitting for very long periods. It's thought potentially that it often needs to be more relaxed than necessarily really stretched, particularly if you are in a very stressful situation. It might be requiring some hydration. So the way I like to start with it is just to actually work through with a soft ball. And this technique is really best done on an empty stomach. You could also work with a rolled up blanket and pop it kind of, if I show you like this, you kind of take your blanket, roll it up, and you could lie on it actually like this. So you're lying on it with it just kind of the blanket underneath the abdomen, underneath the belly button, and then down between the legs. And you would just lie over it like this and prone. And if it's a very sensitive area for you, this actually just might feel really lovely. You can just work with some deep breath. You can rest your head on your forearms and breathe here or rock a little bit, which might feel quite nice as a way in. If you want something a little more invigorating, maybe for this area, you could work with the myofascial ball. So I'm just popping this soft ball right underneath the lower belly here. And I'm just going to start by just gently rocking the pelvis from side to side. I quite like this technique being kind of propped up on the elbows, but you could certainly lie down all the way and bring your forehead to your hands. See what you like here. And I'm really just using this to sort of say hello to the tissues, to kind of ease in not sort of shocking anything. And then what might feel interesting here is to tuck the toes. You can also do a little bit of moving up and down on this area. The psoas also has a big link with our diaphragm. It has some myofascial connections with the diaphragm, and therefore actually has quite a big impact on breathing and our ability to take nourishing abdominal diaphragmatic breath. Another option here is you can bend one knee out to the side and then kind of work into the belly that way, on both sides. Just using these different leg positions to just get into this area. And also you can bend the knees and windshield wiper from side to side. Now we can take that a little bit deeper, so you could just stay with that if that's feeling really helpful. As I say, if this is a tender area, this might be where you stay. But we can also work a little bit more targeted with the myofascial balls. So you can take your 2 balls here and we'll work into 3 different spots. So the first one, lying prone, you'll find your frontal hip bones, and you're going to take the 2 myofascial balls just right inside of those hip bones on the soft part of the lower belly. We'll do a few breaths here, and then we'll do the 2 balls a little closer together, literally just above your pubic bone, and then the 2 balls just below the belly button. So for this, lying down, I find it's easier to kind of lie down first and then sort of tuck the balls in one at a time, right inside those frontal hip points. And again, you may prefer to stay propped up, or you may prefer to lie down. I'm going to stay propped up, maybe so you can hear me okay. And then initially just starting with some nice, slow, relaxed belly breath, breathing in through the nose into the belly, expanding, almost pushing the balls away. And as you exhale, letting your belly soften, and you might feel you can sort of sink a little bit deeper in there. Again, this is an interesting area. You may sense one side, one psoas. You have 2 psoases, one on each side. May feel more tender or tight or restricted. So just take note of any imbalances there. And again, stillness might be your jam today, or you could play with a little rocking of the pelvis, or even tucking the toes and just moving the balls a little bit up and down, really scrubbing the inside of those hip bones. Maybe bending the knees, again finding a little windscreen wiper action. And then we'll bring the balls in and down towards just above your pubic bone. So just above the pubic bone, and see how that feels. You stay propped up or lie on down. Some slow, deep belly breath. It's going to again often be a surprisingly tender area. And maybe playing with some rocking of the pelvis. Maybe tucking and tilting. And again, finding some windshield wipers with the legs. And if your lower back is at all sensitive here, again, you could lie down all the way. And then we'll take the myofascial balls up just below your belly button. And again, they're about a centimeter apart or so. And again, just exploring this area. Deep breath. As the psoas runs through the gut, again, it can also have an impact on our digestive system, our digestive tract. You can imagine if this muscle is very tight or restricted, tense, it might have an impact on our digestive system. I personally have found this quite helpful to relieve IBS, symptoms of IBS. Deep breath. And again, because it attaches, this muscle attaches to all of the lumbar vertebrae, you can imagine that it also has quite a big impact on the health of the lower back. So some people find a lot of relief for their lower back by working through the front and releasing this iliopsoas muscle. This last couple of breaths. Good. And then releasing, coming away from this position. And we'll finish working into the lumbar spine, so lower back. And I'm going to work with two techniques here. I'm going to start with the softball. Actually, we will do one technique with the foam roller, and then a couple of slightly more targeted techniques with the myofascial balls. So to start with the soft Pilates ball here, and this is an unusual technique, but it's a really powerful one for the fascia, the sheet of connective tissue that wraps around your lower back. And it's very densely innervated. It's got lots of nerve endings in it. And this fascia, we know certainly from looking at sort of lower back pain, this fascia can often be quite implicated in lower back pain and can get quite irritated and inflamed in lower back pain. And the health of it and maintaining hydration and glide in this area is really important. So this technique works best on bare skin. And what you'll do is you'll expose your skin of your lower back here, and you're going to lift your hips up and pop the ball right into the lower back. And say, if you can, bare skin works really nicely here. And then what we're going to do is support the head with the hands, lift the hips up, lift the head up. And I'm going to keep the ball in position and just start to twist my upper body and my lower body around. I'm sort of twizzling myself around. The ball is not going to go anywhere, but it's sort of starting to twist the skin of the lower back underneath. And when you feel like you can't physically move any further, the ball has really sort of got that skin and is twisting it up, torquing it up a little bit. I can just pause there, take a deep breath or so. And then I'll just reverse and I'll go the opposite direction. So again, the ball is not moving. I'm moving sort of over the ball. It's a little awkward, but you wiggle yourself around. And the ball is sort of, again, catching the skin and sort of twisting it, torquing it. And I can feel it creating a bit of a stretch and a pull, a sort of a little bit of a tug in that lower back fascia. And again, when you can't twist any further, you just pause there, take a couple of breaths. And then come all the way back to the center. And I can feel quite a lot of heat that's generated just by doing that. So you can lower the head down. And once you're back to center, lift the hips and move the ball out. And so you feel this sort of flush of blood flow and heat to the area. Now, if your lower back is good with it, you could also explore a little bit of foam rolling through this area. This may not be for everybody, so again, really work with your body, see what feels appropriate. I like to sort of use my hands here. You can come down into your elbows, depending on your body. And again, I quite like to expose the skin and sort of roll on the lower back with the foam roller. Again, it's a pretty broad sort of brush stroke effect. You can roll a little bit to one side. So again, none of this should feel painful. It might feel a little tender. If you are experiencing lower back pain at the moment, go very carefully with these techniques. You may find that working on the hips feels better for the time being. I wouldn't necessarily advocate for doing this when you're in a really acute back pain episode. Let's switch to the other side. But it can be a great way to just maintain health and hydration of the lower back. And it's fairly broad. I'm just covering that area between the bottom of the ribs and the top of the pelvis. And then I'm going to just come all the way over to one side. I'm going to let the hip come to the floor. I've got the foam roller sort of right underneath the sort of the waist here. So I'm in that soft tissue of the waist. And I'm just going to start to roll a little bit forwards to the front of the abdomen and then a little bit towards the back, again into that lower back. So I'm actually working through the obliques here, these muscles on the sort of the sides of the waist as they sort of tack into the lumbar-dorsal fascia towards the back. And again, this can be often sort of highlights some real stickiness, particularly where the tissues connect to the top rim of the pelvis. Feels good. And then changing to the other side. And if you can do this on bare skin, I recommend that. Really, all of these techniques are great on bare skin. And again, breathing, let your breath to guide you as to how much and how long you want to stay. Okay. Now from here, I'm going to come to the back one more time and work again with the myofascial balls. And again, work a little more targeted on the lower back specifically. And I'm going to take the two balls on the lower back here. Literally, I'm going to start with them on either side of the spine. So I'm not on the spine, but on the sort of fairly ropey, thick muscles just on either side of the spine, for the erector spinae muscles. I'll do a little bit of work here, and then I'm also going to move the balls a little wider towards the waistline and explore a little bit through there. So coming onto the back, putting the two balls right into the lower back, either side of the spine. And again, everybody's so different in terms of the shape of their lower back and sort of how much they can tolerate. So if this is very tender for you, you could always take this to the wall as well. I would really recommend that. But if it's okay here, again, if you can let the hips rest on the ground and really let the buttocks soften to the floor. So the balls are sort of putting the lower back into a little bit of an arch. And maybe, again, to start with just some deep breath into your back. Seeing if you can feel the lower back expand outwards into the balls as you breathe in. Feel the lower back relax and soften over the balls as you breathe out. And you could stay there, or again, you might this time add a little tilt of the pelvis. So you're rolling the hips off the floor and then releasing the hips back down to the floor. Or you could find a little bit more here by coming up onto your elbows and sliding the balls up and down on your forearms. Other options here is to, again, rock the knees a little from side to side, just kind of tick-tocking the weight to the left and the right. And again, if you know that you can tolerate a little bit more, maybe bringing one knee in, do a little bit of rocking here. So these are all just suggestions, different ways of exploring. Find what speaks to your body, your nervous system. If you feel like you can really take quite a bit here, you could even bring both knees in. Again, that's sort of stretching those tissues at the same time as you're working into them. Okay, and then I'm going to take the two balls a little wider now, so they're more in my waist, on the sides of my waist. Now, again, you may or may not feel very much at this point. And to feel more, you can start to really lean onto one side. So I'm focusing a little bit more on the right side, and I'm tipping my weight into the right side. And if you can see here, the ball is just to the waist here, the back of the waist. And then I'm actually going to use my legs here to help me tip over. So now I've, all of my weight is really on this sort of right ball, and I'm just gently exploring this right side of my lower back and sort of gently pressing the ball into the side of the lower back, looking into the QLs here. You can find a spot, you can rest on your forearm. Nice technique here is to tuck and tilt the pelvis again, so arching and then rounding the back. Some people, they might find they get even more if they just come all the way over to that side. So again, I find this is a bit of an really individual, down to the individual. And it's important to really not overdo this. Sometimes this one, again, can be quite tender, and you don't want to overdo it. I'm going to go to the other side. And over to the left side of the waist. In. And slowly and gently exploring how much weight does it feel good to put in. For this side, I feel like I can tolerate putting more weight into it. I can move the head up a little bit, maybe tuck and tilt the tailbone. So moving slowly, not assuming, not sort of rapidly going into these things, but just dipping your toe in the water, get a sense for how the body's responding, and then adjust accordingly. So we don't shock this area, we don't kind of shock the tissues into submission, but we're just working with sensitivity, listening in, monitoring your breathing. And then when you feel you've had enough, releasing the balls out from underneath the back. And again, just take a few moments with the legs bent or straight, maybe the hands resting on the abdomen, and just feeling the effects. Again, you may sense warmth, blood flow. Maybe your back is landing or your pelvis is landing a little bit differently. Maybe you're noticing more systemic effects, a feeling of relaxation or calm, changes in your breath, speed of your breath, the location of your breath. And then you're welcome to stay as long as you like, just absorbing and observing the effects. When you feel ready to come out, I always recommend rolling to the side and using your hands rather than your neck or back muscles to come up. So that's your myofascial routine for your hips and your lower back and pelvis. I hope that was helpful, and I look forward to seeing you in the next session.